This session will feature two panel discussions focusing on critical topic senior care, community and technologies. To begin, we have our first panel discussion titled as Creating an Inclusive Ecosystem for Seniors in India. Let me introduce our moderator, Runam Mehta, Chief Growth Officer at Primus, India's largest service platform for active agers. Runam Mehta, a physiotherapist by education, has spent close to 18 years in the healthcare. As a clinician, consultant, and a business leader, she has spent 7 years at Porsche, India's largest home healthcare company that gives her unique insight into the dynamics demand and supply side of the long-term care. In her current role as a Chief of Growth of Marzi by Primus, she brings together her passion for innovation in care, customer insights, and business acumen. Thank you, Runam Mehta, for joining us.
Thank you. I'd love to welcome on stage my fellow panelists. Let me start by calling on stage Nidhi Chawla. She's the CEO and founder of Silver Talkies, a tech enabled community first platform tackling issues of loneliness and lack of engagement opportunities for older adults. They offer opportunities for staying active, social networking, and lifelong learning. Nidhi is also co-author of the book Rethink Aging, which I think everyone must read, and she has several years of experience in the financial sector, having worked at SREI and McKinsey. Welcome, Nidhi. I would also like to invite Pavithra Reddy, a software professional with a strong commitment to leveraging technology and knowledge to enhance the lives of older adults in the last decades. She has recently graduated as a gerontologist, proving that lifelong learning is a reality. And as COO at Vikas, she plays a pivotal role in shaping and executing strategies that empower Indian seniors to lead fulfilling, independent lives. She's passionate advocate for age-friendly communities. And finally, I'd love to welcome Tausif Thangalvadi. He is an MD, Accident and Emergency Medicine, and has special interest in disaster management. He's currently the South India lead for the Faculty of Disaster Medicine in India and Nepal. He's also VP Operations and Medical Director of Red Health, India's largest private pre-hospital care and emergency response system. Welcome, Tausif. Thank you, everyone, for being here. This is the panel where we discuss communities for seniors. And I think I'll take the liberty to start with the work that we are doing at Primus. If I could. Awesome. So I'm here representing Primus Senior Living and the sister company Marzi by Primus. We stand for independence, purpose, dignity, and health for our elders. The previous panel spoke about how health span is so much more critical than just adding lifespan, and that's exactly what Marzi by Primus stands for. In my experience, I think previously India had a lot of stigma that we carried around retirement homes, and slowly we are seeing this change. And I'll give an example. I think the first property that Primus launched back about 7 years ago, I think it took us many months to be able to get seniors to buy into the concept of senior living. Our recent launch, just in December, was sold out in 2 weeks. And that's a dramatic change in just 5 years. So, more and more, I think seniors in India are sort of acknowledging that they do have more full and fulfilling lives if they are part of a vibrant community, and that there is a lot more to life after 60 than what was previously believed. And I'm very excited to be on this panel because it really feels like a lot of propagants of the same belief system are here with me. So start by asking Nidhi you the first question, right? We are building communities for people to live in. However, there are emotional and social needs that need to be addressed, even for those people who aren't really going to make the choice to live in a senior community. So, what was your thought process in building Silver Talkies? And of course, do start by introducing Silver Talkies to the larger audience.
Hi, everyone. I don't know if many of you or any of you have heard about Silver Talkie, so I'll just take a quick minute to tell you what the work is all about. And I think the topic for today, which is communities, lies at the heart of Silver Talkies. And I think our journey started very, very early on, even when the concept of active aging or healthy aging was not really understood or heard of. So we basically are a community first platform for older adults, and we work with people above the age of 55 with the idea that how do you kind of create enough opportunities for them to stay active and hence in the longer term stay healthy. So I think what Runam was referring to earlier, right? The whole idea of how do you bridge the gap between the health span and the lifespan. So we run something called the Silver Talkies Club, where we engage our members through both online and in-person engagement. We offer them opportunities for contribution, for lifelong learning, and these are the four pillars that we kind of follow, which start from care, which covers not just physical health, but also their cognitive, their social and emotional health, financial health, and vocational health. Because these, in our understanding, are the pillars for healthy aging. Then, as I said, the core and the foundation is in the community because I don't know, many of you would have heard of microfinance institutions and the likes of Grameen Bank and how they work. They all work the self-help groups and the peer-based approach. And that is what we have seen working beautifully, in this community as well. Because when they are surrounded by people of their own age group, when they are surrounded by like-minded individuals, the motivation and the inspiration that they get to do better for themselves is much, much higher. And the loneliness and isolation which comes as people age because social networks start diluting because of loss of spouses or friends, family moving away and stuff, right? And to your question, Runam, the reason why I feel it, the thought process that went behind Silver Talkies was loneliness, because when I started out, it was more from observations at home. And it was, very interesting to see when my father retired. My assumption about retirement was that he will now have time to go back, pursue his hobbies, do things which he could never have time for while he was raising a family or while he was pursuing a career. But my retirement gift to him was like lots of art supplies because he was very fond of sketching and drawing. And I thought now is the time when he would do it. But lo behold, he kind of dabbled with it for like 3 to 4 months and then he gave it up. The reason? Because there was no motivation, right? You can self motivation, while it's a very fancy word, I think it's not something which can propel people all the time,
Yep.
which is where community comes in, right? And Reshmi, who was my co founder back then, for her, it was a very different story. When her father retired, he was one who used to, who had a transferable job. He had been to various cities. He was a very social person. But the minute he retired, he became socially isolated. He stopped venturing out of the house. So much so that she started visiting geriatricians to figure out what was really changing. So I think when we started our work, we realized that loneliness, lack of opportunities is something which impacts older adults negatively. Unlike, yes, physical health is a problem. And in fact, WHO's definition of healthy aging says that it's not the absence of disease, but it is about how well can you keep your functional abilities, which could be about building and maintaining relationships, which could be about decision making, but being able to take care of oneself, right? So our whole model is about empowering and enabling older adults to find support for themselves and to be able to support each other. So that's where it's coming from, and I think there have been enough studies which say that loneliness is a big disease, right? In fact, they say that the negative impact is as high as smoking 15 cigarettes a day, right? And there is a Harvard study which was run over some 85 years. And this was trying to study who are the most happy people. And the conclusion that they found, the happiest people are those who have the most active social networks. So I think when research says it and when you see it happening in front of you, that's where it
Absolutely.
is.
Wow. So that was, I mean, I've watched Nidhi's journey, so I obviously know about Silver Talkies, but hearing it from you, Nidhi, is extremely powerful. And I think we second that because that's the whole premise that senior living communities are built on. Adding to your point on happiness, I think one of the happiest communities in the world is in the villages, which is US's largest senior living community with over 150,000 older adults there. So that speaks volumes. Uh, Pratibha, Pavithra, sorry. Pavithra, would you like to introduce Vayah Vikas to us before we move on?
Thanks. Taking from what Nidhi just said, loneliness is the biggest thing, and loneliness is not only harmful for them mentally but physically also. If you've all seen senior citizens who have just retired, who don't have an active life, they end up having physical issues within 6 months. And one of the major things that Vaya Vikas is trying to do is keep people healthy and active as long as possible. We are Vaya Vikas is not an old age home. This is what I've heard a lot of people ask me. As soon as we say we are a trust, we are an NGO for senior citizens, they ask us, where is the old age home? We are not a old age home, and we are not only there for underprivileged senior citizens. What we do is try and work with all senior citizens from across all social strata as well as age group. 60 and above is what we look at. And what we're trying to do is bring the community together of not only the urban but the rural and all across the social strata to make sure that they have a healthy and proactive aging life. And this is the vision of what Vaya Vikas was started as. We are a 4-year-old organization, but our services started 3 years back. And currently, we have just crossed 1 lakh members in Karnataka. And we're looking at moving into different states in India. We're looking at Tamil Nadu next and probably Delhi. Let me just So we work not only with whatever Nidhi said in times of community building and health services. We don't work in silos. We don't have a community of our own, or we don't have health services of our own. We believe in using or working with partners who have good collaborations, who are in the space, who are already doing phenomenal work. And I'm glad to say most of you are our partners. And we'll take that forward because everybody creating the same thing doesn't make sense. It's more important that we build on what others are creating and work from there. And that's where our I would say, main area of work lies. We work in two main areas. One is legal services for senior citizens. We believe that everybody needs a good legal advice that is free of any kind of I would put it as money involved, because when money is involved, the advice is not very clear nor very free, is what I understand. So, what we want to do is bring about a free advice where people can get what they want to know and then take their own independent decisions on what they want to do next. And the second part of it that we are working on is advocacy and policy changes as well as research. Advocacy and policy in the space is very important. I think in the last 3 days you would have heard of the numbers of senior citizens, the number that we are going to add in India and how big it is. And at this stage, we are not ready to work on it, nor do we have the systems in place. And that's where we come in and trying to bring about the changes that is required for the space.
Absolutely. Thank you for that. I will ask Dr. Tausif to talk about Red Health, and I'll ask my question.
Yeah. Oh, I was just checking if that's working. Thank you for the opportunity, first and foremost. I'm literally the odd one out. Thanks to all of you working in the healthy living space and we working in the when the healthy become unhealthy. What do we do? I have a quick question to the audience. In the unfortunate event of an emergency, how many of you know which phone number to call? Not bad. This is a pretty well educated. And I'm talking about healthcare phone number, not your neighbor or something like that. I said healthcare phone number. Okay, still a similar show of hands. That's fantastic. Right. And also, how many of you think that the ambulance service in India is on par with the rest of the world? Okay, 1, 2, 3. All right. So let me give you a quick statistic. If you are thinking India doesn't have enough ambulances, we have twice the number of ambulances that the WHO recommends. But unfortunately, we still don't trust it. Red Health is here to try and solve that problem. Right, so we are a one-stop shop pre-hospital care provider, right from dispatcher to pilot, paramedic, ambulance, and not just road, but road, train, air ambulance. We also do teaching and training academics in pre-hospital care, and we are also moving into elder care. And I'll come to that later when I talk to Runam about other things. But quickly just telling you, putting ambulances, pilot, paramedics is not enough. It is the era of digitization. Tech is everywhere, and we are trying to innovate. What we have created at Red is this ecosystem. If you see at the top on the right, there is something called as Red Family Protect. You can subscribe for a family member. Let's say a lot of people live away. They move cities, they move countries, and then the family is living by themselves. You can subscribe and say, my family needs protection. Their details are there. They can trigger in case of an emergency. We offer the same thing to corporate companies for their employees, protecting the employees and families. So once a trigger of that sort or a call comes into us, we have a homegrown platform, it's called Red Operating System, where every call is tracked, both for quality control and to prevent deviation. Sometimes in the ambulance industry, what happens is you get into an ambulance, they say, don't go to this hospital, go to that hospital. And this happens in India. And we try to avoid that. The pickup drop location, the pickup is automatically tracked. Very much like your taxi, you know where the ambulance is, when is it reaching you. And you also know who's coming in it, the pilot, the paramedic. Because we are Asia's first JCI accredited medical transport system, only the 7th in the world, and we're very proud about it, we are ensuring that the paramedic inside the ambulance is of high quality and they know how to do the necessary resuscitation. And then we've also given connected ambulances. We live stream vitals to the hospital and the doctor. So for the doctor in the emergency department, they're literally sending a bed out, not an ambulance. They're sending an ER bed out, wherein they get all the blood pressure, saturation, their pulse rate, and also the ventilator settings, what's happening in the syringe pump. And they can monitor, guide, and everything they give as guidance can become a PDF and get attached to the electronic medical record. This is the ecosystem that we have created at Red Health, thanks to innovation. Now we're getting into wearables. We'll talk about wearables when we get into the questions on elder care. This is what Red Health is doing at this point of time in this country. In a nutshell, we're trying to build the 911 of India. That's what we're trying to do. Thank you.
Wow, this was really informative. I personally didn't know that India has double the number of ambulances than we need. Now, if only we had double the number of roads, we'd have fewer problems. So, thank you for telling us. You have a customer in me for sure. But tell me today what happens, right? When an elder is hit with an emergency. And this is something I came across last week, right? We did a survey of hundreds of elders. And what we found is that most elders, while they are most fearful of an emergency or a fall happening, they don't really have a personal emergency protocol in place. Often their help also doesn't know who is the person they're supposed to call. So when the emergency strikes, whoever is around is going to do whatever occurs to them at that point in time, which is probably the worst way to deal with an emergency. So, in your experience, what does an elder do? Who would help them? And what is it that they should do?
Fantastic question. If you can go back to the next few slides on that slide that I was showing. So we found the same problem. We asked people to get their family member to subscribe, but we found that a lot of elders living alone wouldn't be able to make the call. They'll fall, they'll not be able to connect to somebody, right? And they have to be dependent on a neighbor or a friend to come. But who alerts them? This is a big problem statement that we found. So we went into the concept of machines calling machines. Why does somebody need to trigger? We have a lot of wearables that can, instantly detect that a fall has happened, and that's existing in the market today. So we thought if that calls, if that triggers an alarm, we can then start the rest of the process by ourselves and ensure somebody reaches there to help. So with that, we have recently launched this. This is the emergency SOS pendant. While you see the button, this is also a wearable. The elder can wear it, and in case the elder falls, unfortunately, it will trigger the alarm and it will activate the entire cycle, which I showed you, the technology cycle, where the dispatcher will get an alert, they'll dispatch an ambulance, we'll try calling the elder or the nearest kith or kin who's already registered with us and try to get them to respond as well. We also ensure that there's a concierge service where then they are helping them get admitted or get the care needed at the hospital in case they don't have any support system involved, right? So we're doing that, and we're making it low tech, we're making it across the nation, we're doing that. And this is how the ecosystem looks like for us. So either they press and hold the button or they fall down, and then there's a trigger, and then the ambulance dispatch happens. But we're also adding more. As we learn more about the requirements of the elder community, we are adding medication reminders. We are adding caretaker alerts. So if there is a documented caretaker, they get alerts if the elders start wandering beyond designated areas, because that pendant is geofenced. It tells what is the location of the elder as well. So in case somebody is going through an Alzheimer's or dementia and they start wandering away, we can also alert the caretaker as well. And we've moved on from there. Today, our current product is Flash. We're working on Flash. A lot of elders, even if they don't need the pendant, find it very cumbersome to go to a hospital for an injection, IV medication, nebulization, order medications, bedside care, nursing. So an ambulance is a walking, talking medical shop. Why just use it for responding to an emergency? Why not bring that, a healthcare provider who's trained in giving injections to give injections at home, nebulizations at home, injury dressing at home? So we are moving to Flash, where we want to deliver quick healthcare and make sure that elders who find it difficult to reach a hospital can get the care that can be done without an actual visit to a doctor at home itself. That's what we're working towards in the elder
And
community.
if I may just add, so just to answer your question, which you put to Dr. Tausif, so actually Silver Talkies has tied up with Red Health, solving for that issue where seniors who are living alone have this biggest problem, like how do I take care of myself in emergency? So we are, introducing the emergency assist service through Red Health just to solve that issue.
Awesome. So you have a recent partner and a future partner on either side of you. I think very, very
I'm
useful.
so happy I came here today.
What the trip. Absolutely. So great. I mean, good to see this because I've been in home care in the past and this looks like home care on steroids. So that's great for the ecosystem. I'll direct my next question to Pavithra. You did mention a little while ago that you, as in Vikas, has moved beyond health and also looks at legal advice, financial advice, and advocacy for elders. Can you elaborate a little bit more on why advocacy is an important pillar of an aging population?
So, as I said earlier, we are going to be 300 million in 2050. And we don't have the systems in place. One of the biggest systems, and I think the conversation before on national framing for aging was also talking about, and even the Lassie study was talking about elder abuse as a big thing. It is still a reality, and it will be a reality not only in India, it's a worldwide issue. And elder abuse, most of it relates to financial freedom. It also relates to legal issues within the family. And not a lot of people are willing to come out and talk about it openly or find solutions. So what we want to address at Vayah Vikas is trying to be the voice for that senior citizen who cannot answer for himself, and try and bring in those policy changes, try and bring in those advocacy changes, not only with the government, with the corporate sector, even within the communities of senior citizens, so that a senior understands his rights, a senior's family understand what can be provided, what the government provides, what the senior citizen itself is, he or she is entitled to from the government side, from the corporate side, and also to ensure that whatever is being done, if it's not enough, how can we bring in more policies and bring in changes that is required. Right? It's very easy to say in India that yes, the government is there, the size is so big, how do we handle these things? But unless the whole community comes together and unless people like us, Vayah Vikas, which is a not-for-profit organization, communities that are being built by all of you come together, we will not be able to answer those questions. So one of the other things that we do, and like I said earlier, is try and bring everybody on the same platform so that we can find solutions that work for the senior.
Awesome. I think bringing an ecosystem together in a nascent industry is a difficult but very, very important job. Dialing back a little bit, I think Nidhi spoke a few minutes ago about peer to peer support within your community. And I'd love to know what two questions actually, not one. One is, of course, what does this peer-to-peer support look like? And second question, which it remains a question in my mind, right? While we all understand the importance of community, how important is access to the community? What drives an elder to go that extra mile or travel, let's say in a Bangalore, in order to be part of a physical space or a physical community?
So I'll answer your first question with an example. So when you say how the peer-to-peer support really works, so our youngest member in our club is 55, and our oldest member is 96. And this oldest member, she actually resides in a assisted living facility. She actually resides in a Atulya home in Chennai. She was gifted the club membership by her daughter-in-law, who's also a club member. And the interesting part of this whole, setup is that since we do a hybrid model, which is also kind of goes into your second question, we follow a hybrid model, which is both the online and offline engagement. So the online model works for people who can't venture out of their homes for whatever may be the reason. Could be health concerns, could be mobility issues, could be travel arrangements, anything. So just for the lack of those facilities, they should not, they should not have an opportunity. They're not devoid of that opportunity. So this, member who stays in an assisted living home, she has signed up for our bhajan classes. We have online bhajan classes, which are conducted by a very well-renowned Carnatic music therapist. The teacher resides in Coimbatore. The students are in different cities, Bangalore, Delhi, Chennai, this member. And they have been learning bhajans in multiple languages. So we recently, had our annual program where they performed their bhajans, and I think they sang in some 10 different languages. So I think you can very well imagine the cognitive activity that they received during those classes. So when this 96-year-old joined the classes, she was struggling to sing, because what they do is they learn and they also sing in the next few sessions. So, I actually have a very cute little video recording where she's struggling to sing and she's, saying in Tamil that I am not able to sing. Everybody in the class rallied around her saying, "Mami, you're doing very well, keep singing." And over time, she started singing, she started participating. In fact, I was so overwhelmed to see, and it was so heartwarming that in the chat group that they have for the class, she would actually ask the teacher, "Can you assign me a bhajan so that I can sing in the next class?" That's the transformation in a peer-to-peer group. They rally around each other. Right? Thank you. The second part is actually a half answered there because it's a hybrid model. So while we do in-person meetups, we do them once a month. In Bangalore, a little bit more, maybe twice or thrice, we may have some activities. But I think it's again about because they find friends. They are always looking forward to getting out. It gives them a purpose to step out of their homes, dress up, go meet their friends, have a jolly good time. And then it's also about the diversity of things that you do with them, right? So, for example, when I started out Silver Talkies, like most of us, my assumption was that when you're working with seniors, you will do things like yoga class, a spiritual discourse, only to discover that, boss, they want everything. Now we do theater workshops, we have done ballroom dancing workshops and whatnot. Thank you for bringing that. So here is an example of one of our members. She's 79-year-old now, almost turning 80. She started out in the club because she did not have a social network. For her reason for joining was that I do not have friends, right? In between, she had a phase of depression, then she also had a knee replacement. But those pictures that you see of her are during her years with Silver Talkies, where she found the artist in her during the COVID years when we were conducting online classes. Then once COVID was gone and we started having, so we have an annual event called Samvad around the World Elders Day, where it's an intergenerational concept where older adults from our club, they join hands with youngsters from the likes of Christ University, JD Institute of Fashion Management and stuff, and they perform together on the stage. So that picture where she's, a theater actor and the classical dancer, they are from the Samvad performances of 23 and 24. And after her knee replacement, she has been attending a lot of online classes for fitness. So much so, she actually, recently we had the Bangalore Hub, as part of which her son, who's Arun Pai, he did this footpath challenge in Bangalore where they were walking on footpaths almost for 10 days. She actually attended all 10 days. So that's the transformation the peer group brings in on you, because you have the community, your peer group to motivate you.
Can I just add on?
Of
Sorry.
course.
Uh, so when you're talking about community, I can give you two more examples. We run TCS Senior Citizens Run, and when we started 3 years back, we had 800 people. This year, we're looking at 2,000 senior citizens participating in it. The thing I want to bring out, what Nidhi was saying just now, is that we have people who come at 3 in the morning for something that starts at 8 o'clock because they want to be part of the community. It's the place where they get to meet others. And it gets over by 9:30, they don't want to leave.
Yeah.
Because they've met people, they have walked, they're tired, but they just want to stay to meet everybody and be there. It's a myth that seniors want to sit at home and do bhajans.
Absolutely.
They want to do that, but towards it, they want to add everything else also. It's not just one thing fits a senior citizen image that we have built in our minds.
No, I absolutely, sorry, go ahead.
No, so just a quick couple of things that I also want to add. As doctors, we get called upon to give a lot of health talks,
Yeah.
a lot of communities. And over the last few years, I've been lucky to get called upon many times. The most vibrant community that I've ever given talks to is the elder community. They are so tuned in, they listen so intently, they ask you difficult questions which you have to call upon all your knowledge and wisdom to answer. But it's, for me, it's such a fulfilling and satisfying experience every time I go through that session. My Q&A session goes longer than the actual talk. And they have to say, time is up, please, let's wrap up 15 minutes after the time is up, right? The second point I want to add is with my own personal experience. My father was a fantastic, he used to drive a lot. Everywhere we traveled as a kid, my dad would drive, not a driver. When we became, and we have 4 sons, right? And when we all grew up and we started driving, we loved our dad so much. We said, you don't drive. You're a boss. You sit at the back seat. We will take you everywhere. The excitement of being a boy and being given a car, right? What it did was my father lost his confidence in driving as he grew older. And then he became dependent on us. I regret it till this day that I couldn't do that for him. But after talking to all these communities and realizing that, now if anybody tells me they're old, let them take a rest, I said, no. They want to go shopping, go buy vegetables, do whatever they want. Don't make them sit at home. They want to drive, that's all right. It's okay. That's the idea.
No, absolutely. And I have a similar experience after joining Primus. we thought they want to do spiritual trips. So we went and we said, let's get some enrollments. And the only interest we got was for Japan and Bhutan. We had no takers, 300 residents, no one wants to do a spiritual trip. So the biases are so real. I mean, and that's when we stopped, uh, you know, trying to stereotype and started listening to the audience. So the class that they wanted to do was a dance class, and they put up a fashion show at the Asli conference. I mean, it takes a little work to start to think differently. I'm, I think, the newcomer to this
You
industry.
will be surprised when we finish one edition of Samvad, they're already asking us, what are we doing next year? And I'm like, I'm having palpitations and panic attacks. What am I going to curate now?
I can
It's that
imagine,
difficult.
Nidhi. I can imagine. I think I will look at the audience now. I mean, I'm sorry, I have a lot of questions for the panel, but I think I'll give you guys a chance. Lots of hands up. I think ladies first. We'll go with the student, and then I'll come to you as well.
I, it's an excellent panel discussion, and including the moderator, we learned a lot from your views too. My question is, ambulance services and these services were traditionally done by the government. But now with the private sector coming in, what do you think, does it improve the accessibility, service quality, or create inequities in the background? And additionally, after this, how do you think private and public can go complementary in hand in a country purely like India? Because you said you want to be 911, but 911 is typically followed by the government.
It's a fantastic question, right? To answer the first part of the question, private healthcare coming into the public space, does it help or does it create inequities? You just have to look at hospitals, government hospitals and private hospitals. What have they contributed, right? Today, a lot of us who can afford care would we go to the government hospital or to the private hospital. What private investment into healthcare brings is quality. It improves the ability to deliver higher, how do you say, higher costing equipment, higher costing manpower, services that try to stick to ETAs, arrival times, or certain markers which are important for them to be answerable to. The government also tries to do that, but we are a country of 1.3 billion. We are 130 crores or 140 crores now, and it's very difficult for even with 1% of our GDP or 1.52% to do that at scale. So there's a big problem the government faces, which the private sector tries to fill in. The second part is the more fantastic question. How can they work together? This is the era of managed care. It's no longer should the government do it or should the private sector do it. The best example which comes to my mind is the Passport Seva Kendra. When we were kids, going to the Passport Seva Kendra meant like a really difficult time. You had to have agents, there were long queues, you don't know what time you would go. Today you go, because of the public-private partnership, it's a breeze. You can walk in, walk out, only at the last layer the government staff are sitting, and then they come out. The government increasingly is looking towards managed care. If the private sector can come up with a great model, a working model, the government is ready to invest money because they have the money. They need people to step up and say, put up their hand and say, I will do this for you. And that's how even emergency care is working. The 108 system that you're talking about is the government spending the money, but some private contractor delivering the service. So managed care is the future for India, is what I think. The other healthcare experts can differ.
Thank you, Dr. Tausif.
Can I add to what he said about the private public this one? In Ministry of Social Justice and Empowerment, which is the primary holding one for senior citizens, they have a program called as SAGE. SAGE is a program which is actually looking at investing in senior care startups by the government. They are providing funds to help these startups do well. So that's another example of how this is going to work in future.
Thanks, Pavithra. We have a question from the audience.
Yeah, good afternoon, doctor. Can you hear me? So you mentioned about the services being provided in cities, and I would understand tier 1, tier 2 as of now. What is the plan to roll it out across? Because there's a huge segment of a population in tier 3 and beyond, and where technology will also play a part in terms of the connectivity availability.
Exactly. One of the things, if you had noticed, of the many lines written in that emergency SOS button is, we are working with 5G, 4G, 3G, 2G, and Volt Edge. So that emergency SOS button is supposed to work across all network ranges of the internet, right, or the internet service provision. That is being built with a view to take it to tier 2, tier 3 cities. Even in our ambulance service today, we are serviceable across more than 100 cities in India. In fact, for one of the big commercial airlines, we are their emergency response provider across 88 cities, including Port Blair and Andaman. So we've managed to do that and get into tier 2 and tier 3 cities. But even for elder or assisted care and emergency response, we are building technology which doesn't have to rely only on high speed internet, so that we can take the technology across. That's what we're trying to do. Thank you.
Thank you, Dr. Tausif. But I'll extend this question to the other panelists as well, because so far we've all been talking about the urban elder. And how do we extend everything that we're doing to the rural elder? Any comments?
Okay, so my understanding and my learnings have kind of told me this, that while of course there is no one size fit all approach which can apply, because the cohorts are very different in their everything, like socio, not just the socioeconomic strata, but also but at but the intrinsic factors are pretty much the same in terms of loneliness, lack of engagement. In fact, one of the passion projects that I have, I wish I would have an opportunity to deliver on it sometime. I feel we really need the Anganwadi kind of system for elders, which applies to both urban and rural older adults, where you have these active aging spaces, a whole neighborhood network of such active aging spaces where they have the opportunity to just come and spend time as often as they come, right? Like the question that you asked me previously, right? The limitation is traveling, right? They want to do things, but they are limited by resources and other things. But then having such neighborhood active aging, we ran actually one pre-COVID. We ran it for 2 years in partnership with the Rotary Club. And people residing in the vicinity would come 3 days. It was a 3 days a week center. They would come every day. There was an activity planned for them, and they used to have a ball of a time. But then when Rotary Club pulled the plug on that center, I till date when I meet those members, they're always asking me, when are you restarting the thing? Because they really enjoyed them, like from a karaoke session to again the dance and everything else that they did there, right? So I feel having those neighborhood active aging centers is something which applies to both rural and urban seniors. In fact, there in rural areas there are models like, I think Tata Trust has one and they started something in Karnataka very recently. So that is one concept which I feel applies and can be, taken across cities.
No, thank you, because I think I was talking to a few people in the audience earlier and we had a very similar conversation.
So, yeah, my take is, and again, I'll add on to what Nidhi said, community and activity centers in communities are very important. We want to run a program where we are saying one senior, or like I said, we work for all senior citizens. One senior sponsors another senior citizen who cannot afford it, right? That will make it sustainable in some way to start with. And we are looking at opening activity centers across that can become sustainable. We are working with some partners who can bring that to port and to see how we can make it into a sustainable one in the long run. I think St. John's was one of the few who started in the first and who have shown a plan where it can become sustainable. So based on that, it can be done. And whatever we try to do in terms of the advocacy and policy changes, it is aimed that it reaches every senior citizen in India. It doesn't say we are only doing it for the urban or only for the rural or only for underprivileged, because it has to work for every one of us.
Thank you. I think there is a lot of questions in the audience. We're going to take 3 more because we have, 2. Okay, I can only take 2. I can see you hopping off your seat, but I'm sorry, there's someone else, and then you'll be next.
Hi, yeah. Firstly, congratulations for the wonderful work you all are doing in the geriatric field as well as the pre-hospital care. I'm Dr. Deepthi, I'm from Singapore, and I see a lot of community work done in the senior care. In fact, right now they've launched Healthier SG and all of that. two questions. One is with respect to daytime care and daytime centers. So even if maybe families don't want to, sign up in buy real estate and put their elderly in like an assisted living facility, what about like daytime centers where people can go to work and then like just how you have childcare centers similarly for the elderly? So that's number one. And secondly is, for example, uh, so I'm talking from from a personal experience. Like my parents are 60 plus, but I also have a grandmom who is nearing 90. So my mom now she's burdened. I shouldn't say burdened, but of course there's a lot of mental load, right, to take care of somebody who's that elderly. So what happens is that kind of curbs my parents' activities during the day. If they want to travel elsewhere, they're not able to identify a certain place where my grandmom can be safe and she can be taken care of. So assisted living is a great solution for community and a long term. What about short term?
So I'll take that. I think there are short-term care, even daycare facilities. Kites does it, for instance, and I'm sure there are others. Happy to meet you outside and talk to you about it. Yes, please.
My question was, we spoke about different ecosystems for the elderly. That considering India is a major lower middle income and the middle income cadre, we have a lot of, I mean, from my personal experience too, that when we ask the elderly about the different ecosystems, the only thing other than their house they know is old age home, and which is also looked down upon for different reasons and a stigma attached to it. So how do we address this issue? They don't even know that different ecosystems exists, like the senior care homes or the integrated homes, and also the affordability of that. So the majority of Indian the socioeconomic status falling under LMIC. So how do we address this issue?
Should I take that? I think everyone in the ecosystem, and I'll speak for not just the people here, but a lot of our colleagues in the audience as well, that we are all working very actively to do two things. One is increase the awareness of an average elder about what their options are and what exists out there. That's number one. And the second thing we're actively trying to do is plug the problem, so to speak, in different ways. So we have someone working on employment, we have someone working on community, we have people working on advocacy, we obviously have people on health, and someone like me who's working on living. There are solutions out there, and we have to create the awareness around it.
And if I
Thank you.
may just add there, I think a part of the responsibility also lies with us as the youngsters, because we do know that uh, older adults, the seniors, are kind of digitally constrained in their savviness, right? So they can't really scramble for themselves to figure out solutions. So I also feel that we also need to give them that support in finding those solutions. In fact, many of our members came to know about Silver Talkies because their kids found us on the internet. They told them about it. Yeah, the decision makers in this case are still the seniors because they decide whether they want it or not. But then the youngsters played a role in kind of informing them.
Thank you. Thank you, all the panelists, and thank you to the audience.